Norway's universal healthcare system operates under a model where all residents have access to necessary medical services, and it is primarily funded through taxation, ensuring that everyone, regardless of income, can receive care. However, while many adults do pay small user fees for certain visits, once they reach an annual ceiling of approximately 3,278 Norwegian kroner, which equates to about 320 to 330 US dollars in 2026, they are issued a frikort that allows them to access covered healthcare services at no additional cost for the remainder of that calendar year. Yet despite these strengths, challenges such as wait times for non-urgent care persist, impacting patient experiences. Furthermore, education in Norway is structured such that compulsory public schooling begins when children turn 6 years old, with the public primary and secondary systems being entirely free, and public universities typically do not charge tuition for the majority of students, although some exceptions may apply for certain international cases. The public education system in Norway emphasizes free and equal access for all students, starting with compulsory schooling at the age of 6, which lasts for 10 years, after which students can continue their education at free public secondary schools, leading into the realm of higher education where most public universities do not impose tuition fees on their students, although some international students may face specific charges. This structure not only supports educational equality, but also reflects Norway's commitment to investing in the future of its youth. Norway's education system is recognized for its focus on inclusivity and quality, ensuring that all students have access to the same resources, which fosters a strong sense of community and support among peers. While secondary education aims to prepare students for both the workforce and higher education, the absence of tuition fees at public universities encourages a higher enrollment rate, allowing more individuals to pursue their academic aspirations without the burden of financial debt, contributing to a well-educated populace equipped for the challenges of the modern world. In addition to its commitment to free primary and secondary education, Norway also places a strong emphasis on the overall well-being of students, integrating social activities and emotional support into the learning process, which is particularly evident in primary schools where play is used as a crucial component of development. At the university level, educational institutions often adopt progressive teaching methods that promote critical thinking and collaboration, further enhancing the quality of higher education and preparing students for future careers. Norwegian educational institutions are increasingly incorporating technology into their curriculums, providing students with access to digital tools that aid in learning and foster skills relevant to the 21st century, while simultaneously encouraging parental involvement through regular meetings and communications that keep families engaged in their children's educational journeys. This collaborative approach between educators and parents not only enhances student performance but also reinforces the values of community and support within the Norwegian education system. Moreover, Norway's healthcare system is complemented by robust public health initiatives that focus on prevention and education, allowing communities to actively participate in their own health management through workshops and resources that promote healthy lifestyles. This proactive approach is further supported by a network of healthcare facilities distributed throughout the country, ensuring that even those in remote areas have access to necessary medical services, thereby enhancing overall public health outcomes. In urban areas like Oslo, the integration of public transportation systems facilitates easy access to healthcare appointments for residents, highlighting the seamless connection between community infrastructure and health services. While in more rural regions, clinics and hospitals are strategically located to ensure that even isolated populations receive the same high standard of care. This dedication to accessibility and quality underscores Norway's commitment to maintaining a robust healthcare system that serves all segments of its population. While Norway's healthcare system is praised for its accessibility and comprehensive coverage, it does face challenges, particularly in the area of wait times for non-urgent procedures, as many patients may experience delays that can affect their overall health and well-being. Initiatives are continually being explored by the government to address these issues, balancing the need for immediate care with the sustainability of resources in a system that aims to prioritize both efficiency and quality of service. To tackle the problem of wait times, healthcare administrators in Norway frequently engage in strategic discussions aimed at improving operational efficiency and patient flow, while simultaneously seeking input from the public to ensure that the strategies align with community needs and expectations. This participatory approach not only fosters transparency but also empowers citizens to influence the healthcare policies that directly impact their lives, highlighting the democratic nature of Norway's social systems. In Norway, the healthcare workforce is trained with a strong emphasis on compassion and patient-centered care. where professionals are educated not only in medical practices but also in the importance of empathy and communication, as seen in their interactions with patients, particularly the elderly. Alongside this, educational institutions play a vital role in preparing future healthcare workers through rigorous academic programs that encourage diversity and inclusivity in the health professions, ensuring that the system is well equipped to address the varied needs of the population. In Norway, labor laws ensure that employees are entitled to an average of 5 weeks of paid vacation, a provision supported by collective agreements that further enhance the overall well-being of workers, while also offering paid sick leave and parental leave applicable to both mothers and fathers, which contributes significantly to what is recognized as one of the best work-life balances in the world. This consistency in employee benefits aligns with Norway's ranking as one of the happiest countries globally, as evidenced by its 6th place position in the 2026 World Happiness Report, a status attributed to several crucial factors including robust social support systems, high levels of trust within communities, a commitment to maintaining work-life balance, exceptional public services, and overall high living standards, all of which combine to foster a sense of contentment among its citizens. Moreover, Norway's public transportation network is well developed, encompassing various options such as buses, trains, ferries, trams, and metros where they are available, providing citizens with convenient means of travel across cities and regions. Although it is important to note that ticket prices and travel passes can vary significantly based on the specific city or region, reflecting the local transportation policies and economic conditions. In addition to its diverse modes of transportation, Norway emphasizes the importance of accessibility, ensuring that both urban and rural areas are connected through an integrated transport system that allows for easy commuting, which not only supports daily travelers, but also promotes tourism. This extensive network is complemented by the country's commitment to sustainability, as many public transport options are designed to minimize environmental impact, utilizing electric and hybrid vehicles where possible to reduce carbon emissions and enhance air quality. Furthermore, the high level of investment in public infrastructure reflects Norway's dedication to maintaining an efficient transport system that meets the needs of its citizens, thereby reinforcing the notion that a well-connected society contributes positively to overall life satisfaction. As such, the combination of a strong social safety net, accessible public services, and a commitment to both environmental sustainability and effective public transport systems creates a holistic approach to quality of life that supports the happiness and well-being of the Norwegian people. Engaging in outdoor activities is a beloved aspect of life in Norway, where the stunning natural landscapes encourage a culture of exercise and recreation that fosters physical and mental well-being. Whether it's hiking in the mountains, biking along coastal paths, or participating in winter sports, Norwegians take advantage of their rich environment to promote healthy lifestyles, which is often associated with the overall happiness of the population. Social interactions also play a crucial role in the quality of life in Norway, as communal gatherings, outdoor cafes, and local events create a sense of belonging and connection among residents, further enhancing their sense of community and support. This social fabric not only contributes to individual happiness, but also fortifies societal bonds, making it easier for people to navigate challenges together. Additionally, the availability of recreational facilities, parks, and public spaces promotes inclusivity and encourages all age groups to participate in community life, thereby bridging generational gaps and fostering collaboration among citizens. Norway places a strong emphasis on public spaces and cultural initiatives, as seen in their well-maintained parks and community areas that invite residents to gather, relax, and engage in leisure activities. These environments not only contribute to a higher quality of life, but also facilitate social interactions that foster a sense of community among residents. The presence of art installations and cultural events throughout cities highlights Norway's dedication to promoting creativity and shared experiences, where public art serves as a catalyst for dialogue and connection, further enriching the cultural landscape. Additionally, the government's investment in cultural institutions such as museums, galleries, and theaters demonstrates the belief that access to the arts is a vital component of well-being, reflecting the broader understanding that cultural engagement can deepen social ties and enhance emotional fulfillment among citizens. As a result, the interplay between physical spaces, community engagement, and cultural offerings contributes to the unique fabric of Norwegian life, underscoring the importance of fostering environments that support both individual happiness and collective thriving. The natural beauty of Norway, exemplified by phenomena like the Northern Lights, not only attracts tourists but also instills a profound appreciation for nature among residents, serving as a reminder of the country's rich cultural heritage and its connection to the environment. This intrinsic bond with nature is often associated with mental well-being, as many Norwegians prioritize spending time outdoors, whether in their backyards or in more remote areas. Furthermore, local markets play an important role in fostering community engagement and supporting small businesses, providing spaces where residents can buy fresh produce and handmade goods while interacting with local artisans. This practice supports the local economy and strengthens bonds within the community, promoting a sense of pride and ownership among citizens. Additionally, initiatives that encourage local consumption and support for sustainable practices align with Norway's broader goals of environmental conservation and social responsibility, reinforcing the idea that collective efforts contribute significantly to both happiness and quality of life.